Hello, everybody, and Dr. J here. I am an orthopedic doctor of physical therapy, and what I specifically specialize in is helping people to eliminate chronic pain and to be the best version of themselves. So, whether that's just getting stronger, feeling leaner, also getting rid of their pain, so that's not a limiting factor from the things that you want to do. Today, specifically, we'll talk about sacroiliac joint dysfunction along with low back pain. I kind of group these together just because whenever there's something wrong with the lower back, there's oftentimes some sort of sacroiliac involvement. Some people, there are specific tests to really rule in actual SI joint related pain, but I do want to group these together and share some specific themes that will help you to get rid of your pain. So if you have questions, I want you to drop them into the comments. So as we're going along, you can let me know about what specific pains you're going through from the aspects of your lower back. You can ask me questions about what sort of exercises could be related as well. So I want to do my best to support all of you guys, okay? So let's dive into the prevalence of low back pain. I don't know if you knew this, but low back pain is probably the most common ailment of any other body part. So there are research shows that 9 out of 10 people in the world at some point in their life actually deal with some sort of low back pain in their life. Some people with low back pain, it's just a one-time occurrence versus some people, they have it on the daily, okay? But in regards to low back pain, because it's so prevalent, this is something that I've actually put a lot of research and emphasis to, namely because I myself also had some chronic low back issues in the past. I would consistently hurt myself with either picking up anything over a certain amount of weight. I would feel a pop in my back. I would feel a sense of right after I pop, I'd be crouching. I wouldn't be able to stand up straight. The next day, my back would be extremely stiff. Even just sitting down onto a chair or a toilet, that would be extremely painful. So just let me know, like in the comments, what specific areas of pain, of low back pain, are you actually dealing with? And do you mind just sharing like what sort of things aggravate your pain? So that could be prolonged sitting, prolonged standing, walking. It could be lifting things. It could be doing a certain sport. So I want to see maybe just like on a, just into the comments, what sort of low back pain you're dealing with and what sort of things actually aggravate your pain. Okay. So I wanted to, first of all, mention as well that sacroiliac pain is a little bit different from just generalized low back pain. So how do you describe sacroiliac pain? The sacrum and the ilium makes up the sacroiliac joint. So with regards to the sacroiliac joint, the sacrum is a triangular shaped bone that attaches to the lower aspect of your spine. So it's the lowest aspect of your spine, and it makes up the sacral base along with the coccyx. And the coccyx is basically the tailbone at the last portion of your spine. The sacrum in itself is not an actual move. It is actually in itself, the sacrum, it may be a lot of nerve roots coming out, but the sacrum though, it doesn't have a lot of movement. So between the sacrum and attaches to the lumbar spine, the sacrum laterally connects to the ilium, and the ilium is the largest part of your pelvis. So between that, the sacrum has tons of ligaments that attach to it. So therefore the movement there is very minimal. Okay, so even though I'm sure some people have been diagnosed with either sacroiliac instability, they say that like your sacrum is out of place, but that's actually not true. The sacrum has very little movement there. So if there's very little movement, then really a lot of my clients actually benefit more from stability exercises rather than trying to get the sacrum to pop or like trying to move the leg length discrepancies on certain ways. I don't find that that's very helpful. So if somebody like pulls in your leg, it might be relieving temporarily. Like somebody pulls in your leg and says they realign you or you feel a pop. But realistically, those types of things don't help a lot of my clients with sacroiliac dysfunction long term. If anything, it's just some short-term relief because somebody like had pulled your leg so hard that you heard a pop or a cavitation. None of that actually really helps long term. So truth being is that because you know that the sacrum has very minimal movement, there is a lot of ligaments that constrain the sacrum movement. So if you know that if the ligaments, which are basically non-contractile structures, if those are non-contractile and they basically just attach one bone to another, then how do you actually stabilize the sacrum in order for you to start feeling less pain with walking, standing, going up the stairs, etc.? So how do you do that? It's mainly through stability exercises. So I'll break down some of the specific muscles that you should be training. And this is somewhat dependent on the individual. So some people might have strong X, but weak Y. Some people have strong Y, but weak X. So if you want to know more about the muscles, comment muscles down below, because I think that if you understand muscles, the anatomy, the certain movements that the muscles can do and why it affects the sacroiliac joint, I think that will only empower you to actually feel better on a daily basis. Okay. So again, continue with the comments. I see some comments down below. I see some questions. So I'll get to your questions in just a bit. Okay. I promise. Okay. With regards to the different muscles, I'll try to give you the priority muscles that I find will help you the most. And then also while I'm explaining, if you have questions more about the certain musculatures, then let me know as well. Okay. So the first thing I want you to know is the glutes. Okay. So why are the glutes, the glute max specifically, probably still the most important muscle of all the muscles? Why is that? Is because the glutes attach from basically your greater trochanter, which are the side hip bones. So if you touch your hip bones on both sides, you feel this hard bone right there. That is your greater trochanter. It also attaches down into your IT band. Okay, so it provides some lateral stability to the leg. And guess what? It attaches directly to your sacrum. In fact, it's the largest muscle that attaches directly to the side of your sacrum. So the glute max contributes to hip extension. That is where if your hips are flexed and you're in a sitting position, to stand up straight and your hips straighten up, that is called hip extension. So that's one way to strengthen the glutes. The glutes are also very strong external rotators. So if these are my legs here, if you can see these two legs, if I bring my heel inward or I bring my foot inward and the knee goes out almost like a cross-legged position, and you strengthen, that is external rotation. And therefore, those are exercises, if you promote external rotation along with hip extension, those are going to maximize the contraction as well as the strength benefits of the gluteus maximus, which again is the largest, most prevalent muscle that attaches to the sacrum. So commonly speaking is that when the sacrum feels very irritated, it almost like shuts off the glutes. And I never like to use that word, but it almost feels like you can't even contract them. Okay. Realistically speaking, even just walking and standing up from a chair, everybody is using their glutes. But are you actually using your glutes more efficiently or learning how to effectively strengthen the glutes? That is a different story. So glutes is the largest muscle that I generally want to focus on when it comes to sacroiliac dysfunction. The secondly, actually being hip flexors. Okay, so why are the hip flexors important? So the hip flexors provide stability from the top. The hip flexors attach from L1 to L5. So it attaches to the transverse processes, which are the sides of your spine, from every single lower back vertebrae, from L1 all the way down to L5, and attaches down into the insides of your groin. So these muscles, you can strengthen them by either actually bringing the knee up to your chest, which is hip flexion. Okay, that's one way. You can actually do some partial external rotation as well. So to actually stretch your hip flexors, you actually go into hip internal rotation where the knee caves in towards the middle and the heel deviates out. But if you want to strengthen it, it's a mixture of hip flexion along with external rotation. Okay, so these muscles are very important because when these muscles are not strong, it basically almost destabilizes the entire lower back, right? So the hip flexors do not attach directly to your sacrum. So they actually attach directly above it. But think of it this way. It's basically, think of a deck of cards or like a stack of cards or even like a building with floors, right? So if one floor or even 2 floors, 3 floors, 4 floors, if those floors are unstable, then what ends up happening to even down below? What happened to the base? That ends up rendering it unstable too. So strengthening the pillars right above the sacrum is going to help you. So one of my golden rules for a lot of my clients is don't just strengthen the area of pain, which I'm a big fan of strength training, but also strengthen the areas above it, below it, and even around it. So if your sacrum is right in the middle, right between your butt cheeks, and it attaches to your ilium, well, strengthen the muscles around the ilium, also strengthen the muscles above the sacrum, which is your hip flexors, strengthen the muscles even below. So the ones below would also include your hamstrings. How do you strengthen your hamstrings? One, hamstrings are a secondary hip extensor. So they assist the glutes with straightening up your hips from a sitting position or even from a squat position. The hamstrings also is like the bicep curl, right? So the bicep curls, as how do you strengthen the biceps, is basically flexion of the elbow. So that bicep curl, there is a muscle in the hamstrings called the biceps femoris. The hamstrings in itself is made up of 4 different muscles. That makes up the hamstring group. So to strengthen the hamstrings, you can bend your knee, which is knee flexion, and you can also go into hip extension. So strengthening that, big exercises are like Romanian deadlifts, it's hamstring curls, it's any sort of hip extensor movement like lunges or Bulgarian squats. All of those things strengthen the hamstrings. Okay, so we went through hamstrings, we went through glutes, we also went through hip flexors. Let's even talk about basically your abdominal group. So namely the obliques and also the rectus abdominis and even the transverse abdominis. So basically that's like basically a large corset that kind of wraps around your body. I don't think I really have to explain the rationale, just considering that said the hip flexors are muscles that above the sacrum that can contribute to sacroiliac stability. And therefore, when you have stability, there's less pain with doing certain movements. But when you're looking at the obliques controls side bending. It also controls rotation. Okay, so if you can't control rotation or control side bending, then that's going to affect the areas right below it. And therefore, then you'll notice that, hey, my sacrum is starting to hurt. So strengthening the entire, basically, corset muscle that wraps around from your lower back into the front and also protects a lot of your vital organs. These are important muscles. So namely, things I like to do for that, it's like planks, side planks. I like to include anti-rotation. I like to include pull-off presses. So there's a lot of great exercises that can strengthen those. Not just necessarily crunches per se, but I do like to actually strengthen, especially with like incline side bends, or let's say you're doing a plank on a Swiss ball or something unstable, that makes the abs work a little bit harder, okay? The last muscle of importance, and this isn't the only one, it's just the ones that I think are most pertinent, would be your lats. So why are the lats important? So your lats are actually your pull-up muscles or your chin-up muscles. So those muscles are very important because even though they attach actually from the inside of my arm, so they attach to the inside, and then they actually attach down into your mid-back, so T12, so which is about right in this area, and it actually connects all the way down into your thoracolumbar fascia. And your thoracolumbar fascia is this weave of like white tissue that lines your lower back, okay? So when people generally have weak lats, the thing is that imagine if you're picking something off the ground. Here, so let me give you an example. I'm gonna see if my camera is following me. So let's say I'm gonna pick up this one kettlebell that's on the floor here, okay? So hopefully you guys can see that I have a kettlebell in my hand. Now the thing here is that I'm gonna put the kettlebell right there, or let's say I was picking up the kettlebell from the bench or the floor, okay? Either way. So when people pick things up, some people will pick things up and they'll straighten up. And ideally, when you're picking up something heavy, you want to contract your lats by pulling your shoulders down into your pockets and lifting it up with using your lats and then also using your hip extensors. But if you don't have strong lats, guess what this looks like? So this is me engaging my lats, okay? Engaging my lats allows me to keep my back straight in order to lift heavier things. But if my lats were weak, my arms flail away from actually tucking it in. And therefore, when I pick up something with poor lat engagement, it's going to look more like this. So I'm going to try and engage my lats, pull up, but then you're going to start to notice the back kind of round out. Okay? So when the back rounds out, what ends up happening is your sacrum, it actually rounds under you, right? We call that counter nutation. So when the sacrum rounds out, then it actually puts a little bit too much stress on the ligaments around the sacrum. And that's why some people in their butt bone, or they'll feel it like right above it, or they'll feel it in their hip, they'll feel some sort of pop because you haven't stabilized the entire system. So basically, lats need to be active. The lats basically pulls things towards your trunk. So you do need to have good lat strength in order to lift things and keep things closer by your body. And your lats also straightens out your back. If you don't have good lat strength, you'll notice that when you pick up something, the arms flail away from the body, and also the body rounds out. You guys understand? So the back tends to round into flexion. And I'm not saying that people that lift with their back in flexion, they're automatically going to hurt themselves. But I would say with heavier loads, you generally do want to brace your abdominals. You want to contract your lats pretty hard, the heavier the weight is, okay? So that's why the lats, even though they don't attach directly into the sacrum, although the thoracolumbar fascia attaches nearly directly by the sacrum, nonetheless, though, don't neglect these muscles that attach all the way into your arms, because that indeed affects your sacrum and the pain that you feel in your lower back, okay? So that is just a really strong breakdown of the main musculature that you should be thinking about strengthening. Again, this is not everything, because I truly think that the body is fully connected. So I think that people that have really poor arch strength and have really poor foot strength actually are more prone to sacroiliac joint dysfunction. I do think that if you have poor quad strength, I think that makes you more prone to SI sprains and SIJ dysfunction as well. So imagine if you're trying to pick up something with like your knees, you're trying to use your knees. They always say use your knees to pick up things, right? So you're squatting it. But what if your knees hurt? What if you have poor quad strength? So if your knees hurt and you have poor quad strength, then you're going to use your hips and your lower back to do more of the lifting. And therefore, again, that can affect the sacrum. So I haven't even mentioned quads and other muscles, but you can see that you can't just take this more like cookie cutter. Everybody that has SI pain or low back pain gets a bridge, or everybody gets this exercise, because you'll start to see that like with every person that I've treated SI, not just dozens, hundreds of times, but looking at the entire person as a whole, seeing where the deficits lie. Where does this person have the chink in their armor? Okay, where do they have a strength deficit? Where might they have a mobility deficit? So that's why, like, a lot of times you might be looking at these, this is great education, but even then, I always recommend to probably see a physical therapist or somebody that can assess your body fully and then give you the right exercises, okay? This is just a grand schematic of the different muscles that I feel you should be focusing on. But of course, I would always say, get an assessment. Don't guess on what you're supposed to do, because if you get an assessment, you'll understand the right muscles that you do need to strengthen, okay? So let me know if you guys have any questions down below. Let's see. So I believe I want to answer some questions here. Let me just scroll up real quick. So if you have a lateral pelvic tilt and one side anterior tilt, what do you try to correct first? The anterior or the lateral? I have SI and lumbar pain. Everything makes it worse, including walking. Okay. So if you have pain, like on, let's say, one side is the anterior, one side's lateral, that, to be honest, is like, you don't want to just think about correcting one thing or another. You can try to just tighten things up bilaterally. So this is what I mean. If you just did a plank, that's not biasing the left oblique or the right oblique. That's not biasing the right side of your rectus abdominis or your left side. That's also not biasing your left hip flexor versus your right hip flexor. You might feel different activation depending on what side's stronger, but you're trying initially when you feel like you're contorted or you feel like you're like whatever it is, and you're anteriorly rotated on one side, but then your lateral pelvic tone on the other side. Doesn't matter. I always think that if you can frequently contract muscles bilaterally, that eventually it starts to correct itself. It starts to even things out. Okay. So I wouldn't even think about correcting per se. I would think about more so strengthening bilaterally, because if you squeeze your glutes hard enough, eventually whatever aspect of like pelvic tilts on this side, your anterior pelvic tilt on this side, eventually that glute is, to get the glute stronger, it's likely going to start making things more in symmetry, feel a little bit more aligned when you do your walking. Okay. So hopefully that's helpful just to hear that. Let me see if I have any other questions. Okay, so I see some people have pain with standing. Some people say they don't have a strong core. Yep, so that's something that you can definitely work on. How do you do lat exercise at home? Great question. I personally have a pull-up bar. So a pull-up bar is a great place to start. If you feel like pull-ups are too difficult, you can always do assisted pull-ups and grab a large assisted pull-up band. You can get those on Amazon or anywhere. And you can do pull-ups with assistance. So that's probably one of your best exercises for lats. You can also do rows, any sort of row variation, barbell rows, pendlay rows. There's a large, I would say Larson rows, pendlay rows, barbell rows. You can do single arm rows. You can do row machines. You can do mid rows. There's other ways are like pullovers. So basically you're lying down on your back. You can also hold onto a weight. That weight drops down towards the ground and then you pull it forward. So I'd be kind of lying down and then you pull it back up towards the ceiling. That's also a good exercise. Straight arm pull down, so pulling a cable or a pulley system down right into your pockets. That's also one of my favorites. Straight arm pull down is great lat activation on that side. I strengthen my lats to death. And I think that's why my deadlift and my ability to lift heavy things for my weight is pretty sound. So again, don't neglect your lats. Hopefully that gives you some ideas on how to strengthen your lats. Wall planks suffice. It's a good place to start. If you're somebody that is starting off super, don't be offended by this, but if you're starting somewhere very low baseline, you don't exercise that much, but you're wanting to get rid of SI pain, but you haven't exercised in months or years. Yes, I think wall planks can suffice, but at some point you do need to make things more challenging. So you never just do one exercise and never try to progress it. So with wall planks, can you hold it longer over time? Can you eventually progress so that your elbows or your hands are at a lower surface? So therefore your body is more parallel and therefore you're able to put more stress on your hip flexors and your front abdominals and everything else. Wall planks suffice for now, but eventually you want to progress duration, intensity, volume, hold time. So you want to progress a lot of parameters to ensure that you're strengthening the muscles around your sacrum further. Okay, these are great questions. Still here for at least 4 or 5 more minutes if you guys have more questions. Let's see. Somebody said that I had foot surgery several years ago. Floor planks hurt my feet. Got it. So if you've had foot surgery and floor planks, if they do hurt your feet, you can always pad them up. You can always do, if that's the only thing and that's why you want to do wall planks, but you need to put more stress on your core, I would probably say wear some supportive shoes. Wear some really thick shoes that will basically pad up your feet. And I think that would be a good alternative. So I'd wear shoes every time I do planks, if possible, if that's the only thing that's limiting you. But at the same time, like I said it before, is that strength, the intrinsic muscles of your foot are almost very codependent or correlated with SIJ dysfunction too. So I always see that people with flat feet, posterior tibialis tendonitis, or any sort of muscular dysfunction in the foot, or any prolonged stiffness, bunions, for example, hallux rigidus, so people that have really inflexible, rigid toes. So I find that when I see that, is that very much so whenever the foot mechanics or the foot kinematics are off, I often see like things like glute weakness, glute med weakness. I even see some SIJ dysfunction as a result of oftentimes the feet muscles not doing what it needs to do. Okay. And then getting orthotics, I'd question orthotics. I have said that to so many people. I find that I think that orthotics are great temporarily. It's basically, imagine if I sprained an ankle severely, and if I sprain my ankle severely, I probably would be on crutches, right? But you don't stay on crutches. Nobody sprains their ankle and continues to just crutch the rest of their life, correct? So why would a seemingly like foot dysfunction, why do people think that they should wear orthotics the rest of their life, right? That you hear that questioning. You don't use crutches your entire life. Eventually you wean away from crutches. So why would you not wean off orthotics? I think that orthotics, definitely there's good research to show that short-term acute effects of wearing orthotics do help. Okay, some sort of orthotic. It helps temporarily, but you know why it helps? It's not like it's permanently like fixing an issue. If anything, it's just distributing the stress to a different aspect of your foot. That's all the orthotic is doing. At some point, though, you're going to be putting excessive stress, especially if you don't work hard, you don't strengthen the muscles of like your legs, your glutes, your core. If you don't strengthen the entire chain, then eventually orthotics will start to hurt. And what I find is that when people wear orthotics long term, is that they end up with calf pain, even more foot pain. They can't walk without shoes. They tend to have more knee and hip and low back issues in the long term. That's what orthotics do. It's because it's seemingly what orthotics do is it will maladapt you. It will negatively adapt you to a point where your intrinsic foot muscles do not have to work hard anymore. So long story short, that's why I'm really big on getting some of my clients, even with chronic foot pain, a lot of chronic dysfunction, and they're wondering about what shoe wear. I'm generally usually more biased towards shoe wear that's more flexible, it's lighter, and seemingly so, as counterintuitive as it sounds, is to actually give yourself less support. And if you give yourself less support, that puts more strain on the ligaments, the muscles, the bones of your foot and ankle complex. But therefore, those muscles actually get stronger, more stable. And guess what happens when the thing that's on the ground, what does that do for the SI? What does that do for the low back? It further stabilizes everything up the chain. And when you have weak foot musculature, that tends to weaken everything up the chain. Okay. I noticed that every single person that I've treated, and I noticed they have some sort of like big toe flexion strength issues. Like they can't press their big toe into the floor, or they have trouble like lifting the toe, or even trouble abducting or even spreading the big toe away from the other toes. What I find is that when I see big toe weakness or big toe dysfunction, I almost 100% of the time see glute max weakness. And therefore, with glute max weakness over time, that's likely to lead to some sort of SI or low back pain. Okay. So this here, I think, should hopefully be a really good, comprehensive, but more generalized way to look at the musculature around your SI pain, see how to look outside the box in terms of what you should be trying. If you are going to some sort of like manual therapy, they're claiming they can realign you or pop things back into place, or they say more like realigning and putting the bones back and making everything symmetrical. Not true. Don't believe that stuff, okay? Because we know that, again, that the sacroiliac joint has so little micro movement that there is no possible way that somebody's hand or somebody's body is like actually moving things back into place, because the sacrum is so stable in itself, and it just has all these like small micro movements. Okay, so you should be thinking about what musculature you need to be strengthening to have long-term pain relief from sacroiliac pain. Okay, so I don't know if anybody else has any questions, but if you do, feel free to tag me at Jason1 down below, and I can definitely get to your comments as long as you do tag me. And also at the same time, if you are looking for coaching, if you are interested in potentially working with me and my team, comment the word help. Be happy to, and if you comment the word help, me and my team will be able to reach out to you just to get a little bit more information on how we can specifically help you. We'll also send you a little bit of homework to share more about our philosophy, how we've helped thousands of people worldwide with getting rid of chronic pain, and how we do that actually from the comfort of your home. So believe it or not, no manual therapy, no injections, no surgery, no massage, no anything like that, no medication, no heat packs, just simply learning how to have the right mindsets to move through your pain, the right exercises that are going to be the right thing for you. So we simply solve people's pain through just mindset hacks, habit hacks, movement and exercise alone. And I think that's a beautiful thing because my clients truly feel that they are independent. They are 100% in full control of their pain. So if interested in working with us potentially, or even just getting more info about what we do and how we help our clients specifically, comment the word help, HELP, and we'll be happy to help you. Now, before we exit out, there was more kind of question, 2-word question. They say no chiropractor. I don't really think that. I think that every profession has its place. Although I'm very biased towards mine because I've seen just so many people get results within our coaching program. But I would definitely say that every person has a place. Like, for example, if you really tweak your back and you're really irritable and your back hurts really bad and it feels like you're just like really off, you're super stiff, I don't think, as long as the pain's not like severely spreading down your leg, if the pain is just staying more localized to your back, along with, let's say it spreads to your glutes, but it doesn't spread further down beyond the glutes, I would definitely say like a chiropractor to get like a minor adjustment or even get to some manual therapy. It can set you in the right direction, decrease your pain, and therefore you can start to do more exercise after that. But however, if the chiropractor is more like you're relying on the chiropractor, you're going every single week, they're telling you to come every single week, or they're telling you the things I said are seemingly lies, that they're saying they're realigning you. They're realigning you every time you come back. They're saying that we're putting the sacrum back into place. I'd run away. I would not go to that chiropractor. Okay. I would also not go to the physical therapist, right? I'm putting my own profession down the drain. If somebody is claiming that they can realign you, that they can realign you, they can perform miracles with their hands, I honestly would run away. I would not see that person because if anything, they're creating more of a reliance on their profession and keeping you as a repeat customer rather than actually helping you and actually maybe teaching you to figure out how to get rid of the pain yourself. Now, although getting rid of the pain yourself, that requires more effort, that may require more consistency. But I find that when you develop that consistency, it develops better habits. So therefore, it essentially prevents long-term that sacroiliac or that lower back pain from coming back. And that's why I value what I do so much, because I love to teach my clients exactly how to take control of any pain in their life with simply just movement as the medicine. Okay, so hopefully that answers your question. I think that chiros and massage and a bunch of those have its place. I do think that where I draw that line is if you're going like every single week, you're going for every 2 weeks, every 4 weeks, and you're doing it for maintenance rather than learning how to fix the pain yourself. I find that's more time, more energy, more finances that you could be spending more of that time doing other more important things. So yeah, hopefully that makes sense. Anyways, guys, I'll see you on the next training. Hopefully you found this helpful. And if you have any question, again, tag at Jason Wan, or you can email me. My email is jason@flexordrj.com. All right. Take care, guys. Have a good one. Take care.